Hello guys, it is story time with Checkers and Jingle here. So I want to talk about more updates, about my ear infection and the visit that I had from the ear, nose, and throat doctor. So the ENT checked out my ears yesterday, and of course, I have an ear infection. So he said that I have an ear infection and that both my ears, they were swollen. So he checked both the ears. So in other words, he checked the right ear. So all I had was impacted wax. And then for my left ear, it was a small amount of wax, that had to be removed with a current. So he used that tool to remove the wax out of my ears. Now, for the right ear, for the impacted wax, he cleared it with a suction vacuum. So it, got rid of the wax. But both my ears are swollen. So, um, he said that I have to take, the cortisporin, which is a medication for 10 days. I have to stop taking the augmentin, and of course, I have to start with the Cipro, which is a medication. And I have to be very careful with my ears during the next 2 weeks. So that means if I have to go in the shower or the swimming pool, then I just have to wear earplugs and I have to avoid excessive water intrusion, you know, to prevent the recurrence of swimmer's ear. So I've been having ear infections in the past. I had it since I was like either a baby or when I was little. Of course, I also had swimmer's ear a lot in the past as well, and of course, um, I also had wax impaction, impacted wax in the past. So yeah, but I do have to see the doctor again next month. Just to check my ears to make sure that there's nothing inside, that there's not too much wax inside, and, just to get my ears cleaned. But overall, I do now have to take ear drops. So all my mom has to do for the cortisporin, the ear drops, my mom has to do 3 drops twice in each ear, and then she has to pull my ear back gently and up each time, and then she has to pump the front of my ear. And of course, to prevent my ears, from getting wet, like when I have to take a shower or, when I have to go swimming, I just have to make sure that I put the water earplugs, I had to put the earplugs, into my ears to prevent swimmer's ear. But it's nothing serious, so I don't have to have surgery, but I do have to be very careful with my ears, and I should not use Q-tips because Q-tips can hurt. But yeah, so that's the update that I wanted to talk about. So what happened was on October 10th, it was mild left ear pain and fullness, and then on my birthday, it got worse, and I had to go to the emergency room. And of course, for my left ear, I had an ear infection and swimmer's ear, and I was prescribed the Floxin, which is a medication, and the amoxicillin. And of course, I have used the Floxin, which is a medication, and then I had to stop using it because, the ear drops, it really hurt. And of course, then my right ear, it started hurting again. But then on the 13th, I had to visit my doctor, and of course, both my ears were swollen, so I had to switch to the augmentin, and she recommended me trying to use cotton wicks with the ofloxacin drops, and then I was referred to the ENT. I've been taking the augmentin, but not the floxin because Every time I take the Floxin ear drops, it hurts. And I still had some bad pain on my right ear, and of course, I still had trouble hearing as I can't hear people. I can't hear conversation. And I don't know what really happened, but I think during the shower, I must have got a little bit of water into my ears. But like I said again, I haven't been swimming for a while. I never had ear surgery, never had tinnitus, and I never ever used Q-tips because I know, yes, Q-tips are dangerous and yes, they can hurt the ear and of course making it worse. I mean, when the guy, the ENT, he brought out the vacuum, the um wax vacuum. I mean, it did hurt a little bit, but it kind of tickled, but I was so nervous. But he was very gentle, he was kind, and he understood. I told him I had autism, and he was really, really patient with me. So, after going to the ENT, so like I said again, I do have to take new medication, which means I have to use the cortisporin for 10 days, and of course, using the Cipro. So, I have to use the Cipro medication, and I just have to practice, using the dry ear precautions for the next 2 weeks. So, I have to use earplugs when I go into the shower or when I go to the pool. And I just have to avoid excessive water intrusion, also known as long term, to prevent the recurrence of swimmer's ear because it has happened to me in the past. But yeah, so that's the updates that I wanted to give you guys. But if things get worse and there's no recovery, then I do have to see the doctor. But anyways, that's all I have to say. Story time with Checkers and Jingle signing off. Bye.